Hello, my name is Libby. I'm a reporter here at LAist, and we are going to be hosting a little live Q&A with a UCLA doctor for the next 20 or 30 minutes to talk about all things air quality. So we're going to be getting some answers on how to stay safe with the wildfire smoke and also in the aftermath of the fires. So I know we've been getting a lot of questions about air quality, what to do if you're returning to an area with fires or where there was fire damage. So these are all things we're going to get into. And I'm just going to take a second to add our guest now. Okay, here we go. Hello.
Hi.
Okay, we're up and running. Okay, everybody, this is, so as I said, I'm Libby, I'm a reporter with LAist, and we're joined by Dr. Rita Kachru, who is the Chief of Allergy and Immunology, I've been learning how to say that, in UCLA's Department of Internal Medicine. Hi, thanks so much for being here.
Of course. Thank you for having me.
So there's a lot to discuss, and I see people are joining, which we're thrilled to see. I think first off, I just want to know how you're doing because it's been a wild few weeks, and there have been a lot of questions and concerns about public health. So how
Yes.
are you feeling? How are you doing?
I'm feeling okay, but I'm feeling very sad about all the devastation that we are seeing here in Southern California and how it's affecting a lot of our community and patients and families. And my heart goes out to all of them because there's a lot.
Oh, she's frozen for a second here. Let me just pause while we try to get her back up. Okay, hi everybody. For everybody joining, we're just having some technical difficulty. Oh, I see you now.
Sorry,
We
I don't know what
for a
happened
minute.
there.
Okay, just we've had some more people join, so I'm going to reintroduce and then we'll get more into it. But I'm Libby. I'm a reporter with LAist, and we have Dr. Rita Kachru with us. She is the Chief of Allergy and Immunology in UCLA's Department of Internal Medicine. So she has a lot of great knowledge for us, and we're going to be asking her a lot of questions. And I share. You were just saying a few minutes ago, just so much sadness and concern for so many members of our community, and I know we're feeling the same here at LAist. So I was hoping to start this conversation sort of about the aftermath of the fires and concerns people have now as cleanup begins, but we're going to pivot because actually a fire has broken out near Castaic. So we want to start with some of the immediate concerns people might have about air quality. So what do people in the area need to know about staying safe while a fire is burning and while there's a lot of wildfire smoke in the air?
Right. So the main issues are not only the particulate matter that's released, both from like exhaust fuel and ozone and what we normally see in pollution, but more so even with wildfires or fires that houses and cars are burning as well, but also the gases that are released, which are volatile organic compounds. And those gases are not normally picked up by air quality indexes. But those are what tend to cause people to have headaches. I have a lot of patients who are telling me I'm feeling like headaches. I'm feeling my eyes are really itchy. My nose is really itchy. I don't feel good. And a lot of times it's those volatile compounds that we are not able to pick up. And then of course the ash that are the bigger particles that are also not picked up on these air quality index reports as well. So it's not just the small particulate matter, which we'll talk about, but it's also these large particles, which we see in ashes, and then also the organic like chemicals or compounds that are released, like the gases.
So given all of that, what are your recommendations? It sounds like number one would be to stay inside if you're seeing
Yes.
smoke.
Yes,
What else?
absolutely. Yeah, so you can actually cut down exposure by almost 50% by staying indoors. So that is really the management of choice is if there's a fire burning close to you or even, in the surrounding area. If you can stay indoors, that's the best thing you can do. Um, Within the indoors, if you can get filtration systems that, like there's a certain filtration system called MERV, which is a really high efficiency filtration system, and a higher efficiency or filtration, the better. You can even clear up to 95% of particle matters if you're up to like MERV 13. And so HEPA filters, high efficiency particulate air filters, that will help as well, especially if they have charcoal, that can help with those particulate matters. So staying indoors, kind of having a good filtration system, running AC, but not the AC that's coming from the outside, but internal AC, is really important. Avoiding things that release smoke in the home, so no wood burning, stoves, or no, like, don't run your fireplace, don't have your incense going or candles. If the lights go out, use a battery. Um, um, I'm blanking on the word, but not any like matches or anything that's going to release smoke.
Right, something like a flashlight instead,
Yeah.
nothing.
Oh my God, I like totally blinked on the word flashlight.
You know what?
Yeah, flashlights.
In a hard couple weeks, and your expertise is so important and appreciated for that reason. So, okay, that sounds like really good, solid advice. If a fire is burning, stay inside. Make sure that air quality is as high as possible while you're inside. Um, I do want to turn to sort of questions we've been getting about areas that, now the fires have burned through them. Obviously, we've all seen the devastation in Altadena and in the Pacific Palisades. I think there are a lot of questions now about how to gauge air quality safety in the aftermath. So, of course, if I'm looking outside and I'm seeing smoke everywhere, I'm probably not going to go outside. I think a lot of people are now feeling anxiety just generally going outside
Yeah,
in LA. And so, can you sort of talk through how you're personally assessing the
yeah.
safety of the air in LA, and what people should be thinking about? Because there's a lot of questions, a lot of anxiety.
Yeah, I think it's really important to know what the like what is the impact, right? What is that? What is the air going to be? How is it going to impact you from a health standpoint? So the it's really important to know what's the concentration of particles in the air, right? What are the components of the particles in the air? What are your risk factors? So, like, how fast are you breathing? Are you a little kid who maybe has a higher respiratory rate because they're running around? Are you a pregnant woman who, the baby's pushing up on your lungs, and so you tend to have a faster breathing rate? So you're going to absorb more. Do you have underlying cardiovascular issues or pulmonary issues? And so it's really important to it's a full picture, right? So the answer is not the same for everybody. The answer is a little different for everybody. Um, in what to do when you walk outside, right? So the initial is, if you can stay indoors, great. That's going to help every population. But walking outdoors, really what's going to affect it is what's the actual concentration you're having exposure to. How close are you to the burn area, right? Are you within a few houses of the burn area? Are you within a few miles of the burn area? What's the wind going? Is it downward of the burn area? Is it coming towards you or away from you? So what's the concentration that you're actually having exposure to? And then what's the components, right? So we know that it is these small particulate matters. And I know everybody keeps hearing about PM 2.5. Now everyone's talking about that. It's like the big word. But basically, it just means that these are tiny little particles that you don't see or you don't necessarily smell, but they can actually bypass your nose and your mouth and go deep into your lower airways. And those are what we worry about, especially if you have a underlying pulmonary, like lung issues or cardiovascular issues, or you're elderly. Um, we worry about those little particulate matters. And then again, how fast you're breathing. So when you're going outside, those are really important factors to keep in mind. So when people say to me, is it safe? Can I go outside? Those are the questions I'm asking them. How far are you from these fires? Are you, within a mile of the fire? Are you 10 miles away from the fire, right? Because that's going to make a difference. Also, use your eyes and your nose, right? Because a lot of the smoke or those volatile compounds you can kind of smell. So a lot of people would call in about the air quality index says it's green, and yet I smell it. I smell something in the air. Follow that smell, right? Because that's more consistent with those volatile gases that are released. So if you smell that, go back indoors, or wear a nice HEPA mask, I'm sorry, a high efficiency mask like an N95 or a KN95. And the firefighters, of course, are wearing and hundreds, but that will decrease your exposure when you're outside. So the distance from the fire makes a difference. What you're smelling makes a difference. If you're feeling that irritation, go with your symptom. Don't just go by a number that the air quality is showing. Because remember, air quality is only showing us particulate matter 2.5 to 10, but those are particulate matter that tends to be released from diesel exhaust fuel, from smog, not necessarily particulate matter that we see released when a house is burning or a car is burning. Then we're talking about much more like metals, maybe asbestos, maybe synthetic fibers that you don't necessarily see with diesel exhaust fuel. So those particulate matter is what the AQI is picking up. Carbon monoxide, the AQI is picking up. Ozone, sulfur dioxide, nitric dioxide, but it's not necessarily picking up those gas molecules, and it's
Mm.
not picking up any other toxins that are released by metals.
And
So
would,
that's why you have to use your eyes and your nose too.
right, right. Right. And so would you say, I think this is something that seems like it's getting through to a lot of folks, right? Air quality index isn't everything, but also it's not nothing. It's a good
Right.
place to start,
It's a
right?
great place to start, for sure. And there's some really good, I think we talked about this when we had spoken before, like South Coast AQMD is a great resource. Air Now is a great resource. If you can afford it, you can buy your own small ones like Purple Now people are talking about, or where you can buy, they're not as accurate, but they're more faster data. One of the issues also with AQI is the centers are spread all over Los Angeles, right? That's like 13,000 square feet of that you're covering. And it's only really registered maybe every few hours to maybe even up to a day. And so it may be that the AQI at 8 a.m. was a certain number, but now the winds have shifted and now it's going to be, a little higher. So really use how you're feeling, especially the irritation or headaches, as an indicator to maybe step back in, rinse off. And one thing that we didn't talk about is after you're outside. So if you're outside and you're feeling those symptoms, or you're very close to a burn area, within a mile or so with the burn area, and your the AQI is low, is high, then wear that mask. And when you come inside, take a shower, take your clothes off that you were wearing outside, rinse off whatever you've come into contact with.
Okay, thank you. This is all super helpful. And I really appreciate you sort of emphasizing that one thing to pay attention to is just how close you are to these burn areas. Just, I'm going to do a quick reintroduction. I see new people joining. So I'm Libby. I'm a reporter with LAist, and we're joined by Dr. Rita Kachru, who's with UCLA. And she's just talking us through a lot of tips on staying safe, what we need to know about air quality. We've been talking about the air quality index and what's not included. So just to ask you kind of a follow up on that distance question, um, basically it sounds like the closer you are to these burn areas, the higher precaution you should basically be
Yes.
taking. Is that fair to say?
Yes. And so if you are visiting a burn area, definitely wear an N95 mask, right? Don't go in there without a mask on, even if it feels okay and the AQI looks okay. Remember, you're getting exposure to ash that's fallen. Ash is something, we didn't really talk about much. Ash are larger particles, so those are not going to get picked up by AQI. So if you're seeing ash in the air falling, go back indoors, rinse off, and you definitely never want to sweep up ash. I just had a patient telling me how they, oh, I put my N95 and then I started sweeping the ash and my eyes started irritating. And I was like, no, don't sweep up the ash. Yeah, you want to water it down, and maybe wear goggles, wear a mask. Again, change your clothes. It should be your smoking clothes outside. And when you come back in, remove them, wash them, take a shower. But you don't want to have dry ash because you're more likely to get into your airways.
And, and so if you don't mind me asking, I remember from the last time we spoke that you live in the Santa Monica
Yeah.
area. Okay, so I think that's a great example for folks because you're quite close to the Palisades. You aren't in an area that immediately burns. So I'm just curious how you're personally sort of handling your own safety. now and how you're talking to your family about staying
Yeah.
safe.
So right now, I think we are like a moderate. I think like if I was looking it up this morning, I think we're a moderate is where we live in Santa Monica, like low, like it's like a low, almost a green. Um, but it smells okay outside. I'm not feeling any symptoms outside. And so am I wearing an N95 walking outside? No. Do I have any cardiovascular pulmonary? Probably TMI, but no, I don't. And so again, I'm factoring that in too, right? So I'm not pregnant. I'm not, a little kid. I'm hopefully not considered elderly, and I don't, and I'm not smelling it or feeling it or irritated in my eyes and my nose. But I am very vigilant, and so one thing that I'm constantly asking my own family is just be vigilant. Like, don't ignore those symptoms. If you're feeling it, then don't assume this is just allergies in the air, because right now actually our pollen count's not very high. We're not in the middle of you know our allergy season where we started seeing tree pollen and grass pollen active. And so if you're feeling that particulate matter, or if you're feeling those gas in the air, go back in. So right now I'm not wearing an N95 outside. My family's not wearing an N95 outside. We're maybe limiting being outside a little bit, so I'm not going for a run outside. I'll do it indoors. And we're just kind of taking precaution, maybe taking, every night we're taking a shower. Maybe we've just taken it in the morning, but I just want to clear whatever I've come into contact with. Just, from remember, our orifices are our nose, our eyes, that's where it's going to get absorbed. It's only when you get very, very high levels where it can actually get absorbed by the skin. But usually at these levels, it's more, where we worry about the skin is when you're going to an actual burn site. So if you are ever, when people are returning to that area, first make sure that everything is cleared out as much as possible, and they've removed all the asbestos and they've removed the debris. But again, while you're visiting those areas, cover your skin, cover your hands, wear gloves, because it can actually even get absorbed by skin as well when the levels are very high.
Mm. Okay, this is all really helpful. Always good to know what a doctor is doing themselves. So, and I think it's also it's a heightened time of anxiety for very real reasons. I guess the only follow up I have on that is, um, how are you talking to your own family and also to your friends and patients about managing those fears and anxieties, very real concerns, and then there's also, it's just a time of heightened emotions. So, what are your recommendations for folks who are just feeling so worried about everything they're doing right now
Yeah.
because of
Yeah.
concerns?
And I really do worry about the psychological impact whenever we have these episodes or these events. We saw it with COVID, right? And I don't, and I see it with my patients with like food allergies who they've had an experience where they've had an anaphylactic reaction to a food, and now they almost become afraid of eating because is it going to always happen? And it's like, no, it's not going to always happen. And so I say take everything you know, a little bit with a grain of salt and not get too hyper vigilant. And that worries me to get too hyper vigilant, right? We could all be wearing our gas masks for months because it's going to take weeks to months to clear up, right? But I don't think that we need to do that unless you are in that very vulnerable population where you do have to take those precautions. So I do really worry about becoming too aggressively covering up and masking, and even in areas that maybe are far from the fires, because especially little kids can absorb that information, and that can start causing fear and other problems. And so I do say take it all with a grain of salt. Check the air. Every morning, check your air quality index in your area. See what the levels are. Not the ones on the apps, they're not as reliable. Use one of the sites, like again, AQMD is a great one, Air Now is a great one. Check the air quality index. Walk outside, see what it looks like. See what are we seeing ash? Are you smelling anything? If you're smelling it, go back in again, rinse your face, rinse your nose. Maybe when you go back out, now we're in N95. So um, really use all of your factors, your eyes, your nose, your skin. Sometimes dryness, our patients with atopic dermatitis feel a lot of dryness right now or having a lot of flares. Stay indoors, moisturize more, rinse off, so take the precautions per kind of how the day is going. Because the hope is, you bring up this new fire, so hopefully we're not going to see our numbers go up again. But watch it, watch the winds too, because that's going to shift what happens, what your exposure is. Because remember, it's concentration of what you're exposed to, it's what you're exposed to, what the components are, and then what your underlying vulnerability
Mm.
is.
Thank you so much. And for people who are just joining, we've talked through a lot of things like what air quality index includes and doesn't include, and distance to fire zones and how that should impact how you're thinking about it. So we'll post this whole video afterwards. So if people want to look back, we've been talking about some things like that. I did see a question in one of the comments that just I happened to read, so I'll ask you. Somebody said, when can I play tennis again in Santa Monica? So, for people who are wondering about things like that, I mean, I know it's potentially going to rain this weekend. Is that something that might provide some relief? Or when would you yourself go on a run outside in Santa Monica? And I know we could do these hypotheticals all day.
Oh, and it really depends on what your vulnerability is, right? So if you have no other risk factors, and it's a good air quality index day, not a moderate, but like a mild, the green levels, you can look outside, you don't feel any symptoms when you're playing. Then you can go, right? If but I would say the longer you are from the burn, the better and better it should get, right? And so we're now a few weeks out. We're a couple weeks out now, right? Almost a couple weeks out, and so it's better than it was 2 weeks ago, and it's going to be better hopefully in another week and another week. And so you can't really answer that question because it really depends on the person, and what's going on in the air at the time.
Very helpful. Thank you so much. And I think we'll do a couple more questions here, wrap in 5 minutes. I was wondering, you've said a couple times different vulnerable populations. One big one is kids.
Yeah.
In part, breathe more. It's hard to tell them to slow down when they're outside. All these things. For parents who are living in fire areas who are now trying to figure out, can my kid go back to school or that daycare, depending on where it is? If it's also close to a evacuation zone. What are the things that they should be thinking about when it comes to, what would make an environment safe for their kid again, whether it be their home or child care or something else?
Yeah. So, in general, it'd be better to stay indoors. So have that daycare or, the elementary school. And what I'm seeing is that these school districts are very, especially Santa Monica School District is very on top of, we've checking the air quality index. We're trying to keep people indoors, or we're allowing it open. So really talk to the school and see, the environment they're going to be going to. And if it's very close to the burn area, if it's smaller kids, I would definitely say stay indoors as much as possible. Um, and then again, as far as running outside, you're going to actually have to use what's going on outside, because it really is going to vary day by day, because it really depends on what else is going on remember, it's not just the burn, it's what was our baseline pollution in the air and our ozone, anyways, like our diesel exhaust fuel and all the other things that filter into the air quality. What was it baseline even without these fires? So really looking at that air quality index, and then knowing your child. So if your child tends to have a history of asthma or reactive airways, or has any cardiovascular disease, that would be a child that would keep indoors. Do I think that they should not go to school? No, I think they should go to school. And again, I'm going to go back to that, the psychological component. I think there is a lot of fear, and I think the kids will pick up our fear. And it's really important for them to have their own community. And what's their community? Their own peers, right? So it's important for them to feel as normal as possible, to kind of alleviate their fears, because they're picking it up from us. I also would, advise parents to, when you're talking about, your concerns, or kind of avoid saying it in front of the kids, because they're picking up on it. They're picking up on your cues, on how you're looking, and then they're going to internalize that. Maybe not tell you, but they'll internalize it, and then that will cause neuroses and fears and other things. So if you can get them back to school, get them back to school. Just, maybe talk to the school about keeping them indoors, really check that air quality, have a very open communication with the school. If you feel like the air quality is up, or you notice it, maybe mention it. Hey, I'm smelling it. I don't know if you can smell it. I'm feeling it. Keep my kid indoors today, right? I'd rather them not go out and play. So it is going to really be person to person, and it is also going to be, um, seeing what the day to day is. Because the hope is that as we move away from this, it's going to get better and better.
Thank you so much. And I did see another question come through in the chat about what to do if you've visited a burn site and then are coming back. And we did discuss that a bit beforehand, basically, removing that clothing, taking a shower. I spoke to somebody last week who said, don't throw those clothes in with the family laundry, wash them
Wash them
separately.
separate.
So we'll post this video and we'll have all these tips for those who missed that part of the conversation. You can watch back, and we also have a lot of resources at our website, LAist.com. Dr. Kachru, this has been so wonderful. My last question is sort of just to zoom out. I think I'll confess myself to not be somebody who has regularly checked the air quality index until now. So I guess I'm wondering, for people moving forward, we also have people wondering, about long-term health impacts, how the air quality is going to be in a month or 3 months. And as you've been mentioning throughout this conversation, air quality can be bad in Los Angeles, regardless of if there are
Right.
fires.
Right.
Just common sense, best practice things you want people to take away as we have this moment of heightened focus on air quality and
Right.
stay.
So that's a great question because we saw this with COVID, right? So right now, I would say check it. I would tell all of my fellow Los Angeles community, check it. This is the time to check it. We're in the acute phase. We just it hasn't even been a full 2 weeks, right? Or maybe it's now 2 weeks. So this is the point where I would check it, and I would say check it for the next few months. Right. Because again, there's other fires breaking out. This is actually, we tend to have other issues with our air quality during this time of the year.
Oh,
2 to 3 months. After that, you're going to start easing off, right? Just like we did with COVID. If you remember, initially it was like COVID counts. Everyone's getting bombarded with COVID counts. And over time, it became less and less and less, right? And it's going to be the same thing as what I would recommend is maybe for the next 2, 3 months, check it every day. Just get into a habit of checking it. As you start seeing we're not having as many issues, we're not seeing as many fires, the air quality index has been overall steady and stable, you're not noticing the symptoms yourself, right? And you can kind of ease off and check it like you were regularly checking or not regularly checking it, right? So it doesn't have to become now this is we're brush our teeth and we check our AQI for the rest of our life. It's, just this kind of post-acute period, and maybe even another 2, 3 months until everything kind of eases off. Again, also how close you are to the burn area, right? So again, I'm in Santa Monica, I'm going to check it for the next 3 months, right? But maybe if I was, in South Bay, I wouldn't. I would check it maybe for the next month and or maybe the next 2 weeks. And if things are going well, then I would kind of leave it at that. So really the distance, how much exposure are you actually getting?
thank you so much, and thanks to everybody who's joined us. We've been speaking with Dr. Rita Kachru, who is the Chief of Allergy and Immunology in UCLA's Department of Internal Medicine. Dr. Kachru, thank you so much. You're a wealth of knowledge, and I think you've also kind of you've definitely helped me understand how to sort of assess risk. And for those who are watching, we have tons of resources at LAist.com, so much more if you want it. And yeah, thank you so much for joining us, and thanks everybody who tuned in.
Thank you. Bye-bye.
Okay, bye.